Good afternoon, colleagues on the table and off the table. I'm going to give you an overview of neoadjuvant chemotherapy in breast cancer patients from a single center by a single surgeon and a single medical oncologist from New Delhi. The data is from 2010 to 2021. 130 patients underwent neoadjuvant chemotherapy. The median age was 50 years, and the time period from 2010 to 2015, 39 patients received chemotherapy, while 91 patients received neoadjuvant chemotherapy in the later 5 years, a significant jump. On the right side, if you can see that 80% of our patients were either triple negative or hormone or HER2 neo positive, while only 19% of the patients were hormone receptor positive. The stage-wise proportion, majority of the patients, as you can see, that almost 90% of the patients were in stage 2B and or stage 3B, while 16.6% of the patients were in earlier stages, indicating that earlier stage patients are also now being recruited to receive the neoadjuvant chemotherapy. Now I come to the response rate versus the molecular subtype. Coming to the triple negative breast cancer patients, there was a total PCR rate of 42%. The total means PCR both in the breast and the axilla, though the axillary PCR was 67.4%. Majority of these patients received ACT, and half the patients also received carboplatin. And as you can see on the right side, that patients with carboplatin had a better PCR rate of 56% versus 39% in those who did not receive the the platinum. HER2 positive and hormone receptor negative patients also had a response rate of 40%. The axillary response was better than the breast PCR, and almost all patients received TCH and or TCHP. The ACTH regime was not a favored regime in our center. The response rate was more or less the same as with P or no P. Coming to the triple positive patients, which is hormone receptor positive and HER2 positive patients, the total PCR was 33%, and the chemotherapy given to such patients was again TCH or ACTH. The other regimes were less favored. The hormone receptor positive HER2 negative patients had a PCR rate of only 17%. And to note here is that 52.4% of the patient had N2 or N3 disease, as the earlier stage disease patients undergo primary surgery followed by adjuvant chemotherapy. All patients in this group received anthracycline and taxanes. Coming to the comparison of PCR between the four molecular subtypes, as you can see, the triple negative breast cancer patients and HER2 positive hormone receptor negative patients had a good PCR rate of 40 to 42%. The hormone receptor positive patient had a response rate of 17%, and the triple positive 33% as expected and as reported in the literature. The follow-up of these patients is little skewed because the follow-up is from 1 year to 10 years, and patients having the PCR, 81% of them are alive versus 73% where there was no PCR. It's possible that the majority of the patients are in the later years, and hence the exact data is difficult to acquire from this group. In conclusions, more of the triple negative and HER2 positive patients are being given neoadjuvant chemotherapy. The PCR is also maximum in triple negative and HER2 neo positive, while hormone receptor positive patients, the response rate is PCR is 17%. Majority of the patients were in stage 2B and above. triple negative breast cancer patients had a better PCR when platinum was added with ACT. And there was also a trend towards higher PCR with TCHP than TCH in HER2 positive disease. And there was also a trend towards better survival with or without the disease in patients with PCR, though the follow up is only from 1 year onwards. But in the end, the point to be noted is that all patients who were referred for neoadjuvant chemotherapy completed their entire chemotherapy, and hence neoadjuvant chemotherapy is feasible and possible in suitable patients in India. Thank you very much for listening.